Good evening, good afternoon, my Sierra Leonean people, my American, my British people, my Nigerian family, my Kenyan family, my Zimbabwean family. Imagine, I'm so blessed to actually have people watching this network all over the world, really. Thank you. I've had some really good feedback since we started. But one of the feedback I had was to actually change the name of the network, which I've done several times. But hey, I'm still learning. And yes, I've acknowledged it. Thank you very much for a couple of suggestions. And that was from my Nigerian friend. I appreciate your thoughts. I just want to say this network is actually available for you to watch on YouTube as well. You can watch each and every one of our shows on YouTube. Follow us on YouTube and press the subscribe button. And please press the subscribe button as well on Facebook and follow us. Then you'll be able to know when we're live because we come live when we can and we bring for you interesting topic. As of today, really, I've got a very interesting topic for everyone today. So if you're watching, please share the video and please invite a friend to invite a friend. Good afternoon, good morning, good evening, and good night to some of you in Sierra Leone. But please watch and share. This is your girl, the Calabash Princess, as I actually call myself, or Fantasy, as a lot of people know me. Anyway, we're going to start a program for you. And today's discussion is really close to my heart because this is something I'll say affects me too at some point in my life. And when it comes to medical diseases, we don't really know about it and we don't talk about it. I'm for one that don't really talk about it often because we are scared sometimes to talk about sickness. As we can say in Sierra Leone, when it comes to sickness, people then they afraid for talk about sickness and death. Now we all afraid for talk about. But at the end of the day, we have to talk about it. We need to learn to discuss these things so that it can prevent us in one format or another. And today I actually have this person with me. He's actually my uncle. And he's actually blessed me with his knowledge today for us to come have a discussion. And one of the discussion we're going to be talking about is preventative medicine because preventative medicine it's wide. I don't have a clue, I don't have knowledge about it, but my uncle is going to come and educate us about it, including myself. I've got a lot to learn from him today, and it's about what people can do to actually stay healthy because it's very big in the world nowadays. We need to know what people can do to stay healthy. So let me bring him on screen and then we can actually have a conversation. Hi, uncle.
Oh, hi, Francis. How are you?
I'm fine, uncle. How are you doing today?
Oh, pretty good, pretty good. You have a very, very good forum here. So
Oh,
I'm so proud
thank
of you.
you. Thank you so
No,
much.
you're
I'm
welcome.
trying. I'm getting it together. So, uncle, for the sake of this interview, I know you're my uncle. How would you actually like us to call you today? Well, me.
Call me Jonah. That's fine.
Okay, I'll call you
Um,
Dr. Kanu
yeah.
because that's your name, and
Okay.
that
Yeah,
is
that's
I'll
fine
stick with
too.
Dr.
Yeah.
Kanu.
Okay.
Okay, Uncle, thank you ever so much for blessing this platform today. I know it's quite new, but I'm trying to
Mhm.
get things together and I'm trying to just introduce to people what we're going to be doing in time to time.
Yes.
And today, I'm not saying you're not from Sierra Leone. So we're going to do this interview also in between Sierra Leone and Creole and also English so that other people can understand it too. But we're going to go inside
Okay.
Creole and English as well. But Uncle, please, I'll make you actually enlighten with Usa you come out and Usa you born.
Well, I'm born Freetown, Sierra Leone. My daddy is a local, of course. My mom is a Limba. Came to the United States a long time ago. My formative years I spent in the DMV area, which is the Washington D.C. area, Virginia, and Maryland. I still have family there. I have sisters and nieces and you name it. And then now I'm in Northern California for the past 10 years or so, since 2012. Um, so that's my story. I've been here about 10 years, like 10 to 12 years,
Okay,
10 years.
that's
Mhm.
good. So you've basically been in California for about 10 years.
Yes.
Okay. Can you tell us a little bit about your background in the medical field?
Well, I was trained in family medicine, and then uh, a I did an extra studies in emergency medicine I'm one of the late bloomers. I started school late. Graduated in 2012. And then I did the fellowship in emergency medicine for a year, and then I work in emergency room. And now I'm working with Kaiser, working in the clinic for Kaiser for the past couple of years.
Okay, that sounds good. Basically, I just wanted to affirm and tell people a little bit your background and where you're from so they get to know.
Mhm.
So when it comes to knowledge, then you know exactly, where your knowledge taps from and everything else. So at the moment, you practice as a medical doctor, right?
Yeah, that's correct.
Absolutely. And you work in California where you're at.
Yes, in Northern California.
Thank you very much, Uncle. And then the next thing again
Mhm.
that I actually want to talk about, Uncle, can you enlighten us a little bit about medical? Because we're actually talking about preventative medicine. Because I don't have a clue. I keep saying it. I don't know anything about the medical field, even though I know a little bit, but not really much. Can you tell us a little bit what is preventative medicine?
Well, preventive medicine is just what it sounds like. It's preventive medicine. There's a saying, prevention is better than cure, and that's exactly what preventive medicine is all about. It's to prevent you getting sick before you get there. And it's a broad subject. We can talk about high blood pressure, what the end stage of high blood pressure, what it will cause. We can talk about colon cancer, which I decided to talk about today because it affects mostly us black people, and it's it's preventable. You can screen for it, and you can avoid getting colon cancer pretty much. That's what I'd like to talk about today, about colon cancer, the screening, and how to prevent yourself from getting it. Can you hear me? Yeah, I cannot hear you. I'm sorry. Uh-oh. I cannot hear you. Can you hear me? Okay. I cannot hear you, but I can just go ahead and talk a little bit about colon cancer. I don't know if you can hear me. I cannot hear you. I'm sorry. Um, well, colon cancer is the third leading cause of cancer death in the United States. So it's a very aggressive cancer, as you can tell. And just last year, about 52,000 people died from colon cancer. And it's very common among us black people, whether it's black Americans or black Africans, extremely common. And it is, as I mentioned before, is very, it's very preventable. And how do you prevent yourself from getting it? You just screen. Get yourself screened. You talk to your doctor about it, and you get yourself screened. If you have to wait and you don't screen yourself, and you get colon cancer, it can be lethal, especially amongst us minorities. You get it, by the time you know that you have it, it's too late. You just have to manage you. The life expectancy pretty much is drastically
Absolutely.
reduced.
Absolutely.
Yeah.
And can you hear
Can
me
you hear
now,
me now?
Uncle?
Yes, I can hear you.
Absolutely. Thank you ever so much. And when it comes to colon cancer, we've actually seen colon cancer in our community, and a lot of people are actually dying of cancer nowadays. But one thing I don't notice, most of the time because they don't go for screening or checking or things like that, and they die just early before then they diagnose them, they're dead and gone. And at the same time, again, they can put on like now witchcraft because that is what we, especially we Sierra Leonean people, that's what we're good at. The moment where somebody died, they don't put and say, hey, now this person kill him on a witchcraft, I don't kill him, make it they die. But they don't really, they don't really listen to the medical field, the medical practitioner. So that is why I'm so happy today where you bless this platform where they can give me knowledge about it. But before we go further, there's somebody where be died way recently, where he was a very, very famous person. I will actually quickly show him picture for me the public go see. This Nabiwiyon Chadwick Boseman and Nabiwiyon Black Panther. And he died a couple of years ago, but last year or so, I can't remember, but he died recently. And it
A
was
couple years ago,
really,
yep.
yes, it be really pain we, where he died. Because at the end of the day, we all be the same. I remember with this picture. I asked you if you remember this picture. when this picture has to come out, we all actually talk. Everybody say in yon, you get what I mean? How,
Right.
the man don't sick, the man this, the man that, but nobody not be enough for say what they go through. So, Uncle, we don't see them picture them there. I just feel like for bringing people them back to memory, make them think about waiting at the actual thing. Because the moment when somebody can sick as well, you get anything and they all man get in your way they talk. So, Uncle, please enlighten we a little bit about colon cancer. Make we know what's not colon cancer and how it affects we body.
Well, colon cancer and cancer of the colon. We get with guts. When you eat, your food go down to your stomach, and then from your stomach you go into your small intestine, and from your small intestine you go to your colon, which is the large intestine per se. And cancer can develop in that colon, in that part of your GI tract. And if that cancer is caught very early, it's completely curable because they can go in here, they can do surgery, get it out, and that's pretty much the end of it. Sometimes people have to have chemotherapy on top of the surgery. Depends on how much the cancer spread. Chemotherapy. Some people need radiation treatment, but mostly if you do the colonoscopy, as we just talked about, and it's caught at the early stage, you just have to go in there, get that part of the colon out, and that's the end of it.
Okay. Now this sounds good, really, because people are not really, as I can say, are they stressed again for make we they go for medical checkup. Because people are not they go for medical checkup, really. And cancer now one thing
Yeah,
where they kill the people them so early. Did they kill, it a kill, it a kill. But we not they really, really talk about it. We not they go for the checkup. We not want for no, we don't care basically, especially the black people and the black community. So this show is really for people to understand. Say cancer, nothing with the kill. And we all the see them. It kill faster than anything else, really. And when it kill you, you they sick, it take you come out your condition. You go away from your condition, basically. And we don't see the picture of we late Chadwick Boseman, and we see exactly how he died and in condition. When you think about the first person where we saw from Black Panther, and we see the picture where he begets later on, it was completely two different things. Them. So, Uncle, we never say this cancer. It's dangerous. It's bad. But waiting at the teen where they make people and get this cancer, yeah, so especially the colon cancer.
well, just like every cancer, there is so much multifactorial causes. We cannot pinpoint on it why this cancer is. But I think one of the things, especially amongst us minorities, we talk about inequities in access to medical care. That's part of it. But also utilization of what we have. For example, what I mean by that, people have insurance. They don't go to their doctor. I said, well, I mean, I've met some patient. You ask them, said, have you seen him maybe in a couple of years? He said, well, doc, I'm not sick. Why should I come? Well, that can be a little bit problematic. If you have insurance, go see your doctor. Even if you once a year, you go there and check your blood pressure, make sure your blood pressure is okay. Make sure you don't have diabetes, you don't have high blood, you don't have high cholesterol, because those two can kill you. Now, in terms of um, um, colon cancer, drinking alcohol can cause it, to a lesser extent. Sometimes it's genetics. If you have somebody in your family who has cancer before the age of 50, colon cancer before the age of 50, you need to let your doctor know that, because usually the screening for colon cancer is start at age 50. But with the exception of if you have somebody in your family, like for example, a first degree relative like your dad or maybe your mom, if they have cancer at the age of 30, let's say 46, then let your doctor know that, because then they'll have to start screening you at the age of 36, 10 years before your first degree family member was diagnosed. It is extremely, extremely important. And there are some other people that have some genetics condition, such as familial uh, adenoposis. From it's a fancy name for people that have polyps. They call it skin growth in their colon. Some people have it at a very early age, and the only way to find that out is if you go get a colonoscopy, they will see if you have those, and then they'll screen you sooner than age 50. Now, if you are black, because it's very common among black, you want to start screening at 45. Even if you don't have a family history of the colon cancer, you want to start screening at 45. Now, when you look back in the last 20 years, let's say from 2000 to 2016, new cases of colon cancer before age 50 has gone up to a whopping 15%.
Wow.
And that's very, very concerning, because you got to think that, the recommendation was to start screening at age 50. So now, if you get some people that are not picked up before the age of 50, then that becomes problematic, just like Chadwick Boseman, which was very, very unfortunate. I believe he was 42 years old. He was even at the age of 45, where at least they could have started to screen him. And with someone like that, it's kind of hard to pick that up, because I don't know if he has a family history. If you do have a family history, I don't know if he talked to his doctor about that. Because, then they would have started screening him earlier. Maybe he would have been alive today. But
Okay.
but that's it. It's we talk about inequity in healthcare access for minorities. Yeah, that might be part of it, because some of us, we don't go to our doctors because of one reason or the other. But the other one is we utilize what we have. I mean, I know a lot of people that don't, they have insurance, but they just never go to the doctor. They said, why should I go? I'm feeling fine. So, and those are some of the causes. Partly genetics, partly maybe our lifestyle. What we eat. The red meat could be part of it. But I mean, again, it's how we take care of ourselves. Pretty much, we have to be proactive about our health.
Okay. I really like the way you educating the people basically, because that is one of the things we need to educate our people. So let me put it in this content. So if let me say for the Sierra Leonean people, if you're not in America whereby it's insurance or anything else, like those of you that lives in England, my family that lives in England, you need to at least once a year, according to what Uncle said, go and do checkup. Go and do checkup so they actually check you up and make sure you're fine. Make sure everything is okay. And for the ones in Sierra Leone as well, once a year, sacrifice that money. We spend money on alcohol, we spend money on different things all the time. But we need to spend money on our health as well. You need to go do that MOT. You know, that checkup for your body where you can say, oh, you go carry your motor car, go for panel beating. You need to take your body as well for that. You need to go do checkup. You need to be going out there. Make sure you check up. Make sure you're good. Make sure everything you're doing good in your body. Because it's not just about us eating food. And you hear what the doctor said. Red meat is one of the issues as well that cause those things. Because even me, I'm suffering from a lot of that. If I eat a lot of red meat, like if I don't go party, I eat lots and lots of red meat, it can act for me for make I even breathe, I can get something like indigestion and things like that. Even the white rice as well, I'm beginning to get out of it slowly. Because as if I say it affects me as well with those things. So we have to listen to the doctor. But before, make I ask Uncle the next question as well, Dr. Kanu. I'm trying, let me say Dr. Kanu instead of Uncle on the live. I'm used to calling you
Don't call-
Uncle.
you can call me uncle. That's that's just
That's
fine.
fine. Dr. Kanu, I was actually taking a little bit of notes while you were talking, and I've actually affirmed as well on this when you said once a year for us to go do our checkups. But the next thing again, you said for people that wait and done the age 50 and above, that is when they go, to do checkup and things like that. What about the young people the way they die right now of cancer? We've got lots and lots of young people that are dying of cancer. I know say you say yes, it's genetic and things like that, but some of them, their family has never had cancer before, but they're dying of cancer. And I even have a friend that died of cancer. So, and he was a really, really young man. So, a lot of people are dying of cancer. Uncle, what advice can you give to the younger generation?
Well, it depends on the kind of cancer. For lung cancer, you gotta keep away from smoking. I mean, for most cancer, you have to stop. Just keep away from cigarette smoking or whatever kind of smoke that you smoke, because that is responsible for a lot of cancer. Some people will say, well, there are some people who have smoked all their life, they don't have cancer. That is true. But there are some, there's a lot of people that have cancer that smokes. I mean, that's just the bottom line. And the smoking can cause all kinds, including pancreatic cancer, lung cancer, I mean, throat cancer. You name it, it will cause that. So that's one of the first thing I would say, you know what, if you smoke, try to stay away from smoking. Drinking, of course, can cause, it can make you susceptible to other kind of cancer. Not as much as smoking, but drinking, to just almost to as much extent as smoking. Don't drink. I mean, I can tell you this. Some people say, well, I only drink, 2 beer a day. Well, if you're a man, you drink 12-ounce beer a day for 7 days a week. It makes you a moderate alcohol user. That means you're abusing alcohol. If you're a woman, you cannot drink more than one. Go into wine. If like wine, you say, well, I only drink, so and so ounce of wines a day. Well, if you're not a woman, you can only drink 5 ounces of wine once a day, because alcohol can cause a lot of problems. And not just cancer, can cause liver disease, which if you do have a liver end-stage liver disease like cirrhosis, you only have maybe about 5 years to live, unless you have a liver transplant. So I mean, those are the two main things I will focus on for the young people, because there's a lot of cancer, and of course, women, go to your OBGYN, get a pelvic exam, let them check you, make sure that you don't have cervical cancer. I know, sometimes it's prevalent it's common among maybe middle-aged women, but there are some younger women who has cervical cancer as well. If you're a young woman, you start out, you're sexually active, make sure you get an OBGYN. Let them do a pelvic exam every 1 or 2 years or maybe 3 years. That will prevent. That will that save lives. And I don't know. I think it's just our culture that we just don't go to get checked out unless we are sick. I'll give you an example. I get a patient who I've been seeing for some time, and then all of a sudden they told me that he's in the hospital. Well, he was sitting down in his home, and all of a sudden he had this terrible headache. And before you know it, he's paralyzed on one side, on the right side, and on the left side. He cannot talk. They take him to the hospital. He spent 2 months in the hospital. They have to open his brain because it was bleeding in his brain. They have to do what we call craniotomy, open his brain so that the brain will breathe. And then they have to do the surgery back, put it back in. And by the time they discharge him to acute rehab facility to help him regain his strength to walk again. Um, and then, to eventually get home. Now he's using a walker, and worst of all, he's on dialysis. Dialysis is where your kidneys are so damaged that they cannot function anymore. So, you know, didn't know that he had high blood pressure. He didn't know because he never went to the doctor. So the blood pressure just keep going up and up and up, and he end up having a stroke. Out of that stroke, now he's paralyzed on one side. He cannot walk, and I end up in a rehab facility, a nursing home.
Wow.
Now he's on dialysis, and now he's gonna need a kidney transplant. Because you're gonna rely on that dialysis. You have to have it. Depending if it's a hemodialysis, you have to have it 3 times a week. If it's a peritoneal dialysis, it's something that you have to do at home overnight. So that's the danger of not going to the doctor. If who knows, maybe if he had come to come and see, they check his blood pressure, know that his blood pressure is high, they would have given him some medication, and who knows, that would have prevented him from having the stroke and having the kidney and issues. So, and
Absolutely,
in
Uncle.
countries, yeah, and I just want to just see people are living in Sierra Leone. I remember when I was back there in 2012, I went for a visit, and someone told me that I used to have blood pressure, and I used to have high blood pressure. Now I'm cured. Well, high blood pressure is not something that you cured. You have to be on medication. It's a lifetime medication, most times, and you need to be checking your blood pressure at home. So we have to change that approach as far as our health is concerned.
Thank you very much, Uncle, for this you enlightenment, because you really they make we they learn. Because for me, I've learned a lot from just this short conversation where we they get basically. Because one thing I've learned, a lot of us don't really take our medical, we body when it comes to we medicine, we body, we emotive, we don't take it really seriously. We go eat, we go do everything, we go party, we go club, we buy clothes, we buy different things, We don't really check up. We don't do that checkup for our body. We don't do wellness checkup. People are like, oh, I don't go to the hospital. I've not been to the doctor for years. I don't even want to see the doctors. I've not been there for God knows how long. Because the reason being, we just think we're fine. And I love what you say earlier on. You said people don't do checkup unless they're sick. That's when they get to the doctor. And we have to stop that pattern. You have to actually, you hear what Dr. Khan is saying? You have to visit the doctor not only when you're sick. you need to actually go and do checkup because you never know. You have to go do a checkup. Whether you're a man, you're a woman, you need to go do a checkup. And please share this video if you can, because it's very educative and it's a short video we're doing. But I just think Uncle needs to come and educate people and learn people and teach people, especially with colon cancer, because cancer is getting rampant in our community. People are dying. Our brothers are dying. Our sisters are dying of cancer. They're getting sick every single day. And we don't really know what is causing this cancer, but now Uncle is enlightening us what is causing this cancer. The red meat we're eating, the alcohol we smoke, the way we drink, the way we don't go see the doctors all the time, we don't look after ourselves, those are the cause, those are the things that actually attribute for us getting cancer. So we need to start learning how to look after ourselves. We need to start learning how to do MOT with our bodies. We don't just put food in our mouth all the time without actually looking at what is going on inside of us. Not just because, oh, I'm not sick, I feel okay. That means, sorry, I cannot go to the doctor. You need to go to the doctor. Whether you're sick, whether you're not sick, you need to at least, Uncle said, at least once a year, go and do a full checkup for your body. I'm guilty with one of them. So let me go back
If
to
I can
Uncle.
just add, oh, sorry. If I can just add it quickly, you said you was asking what are the causes. And
Yes,
another
Uncle.
thing to keep in mind is the physical inactivity. I mean, a lot of us, I'm guilty of that sometimes. We're not physically active, and so we put on the weight, and the weight exposes us to diabetes. So all of these are risk factors for a lot of these cancers that we're talking about, the colon cancer and everything else. Being physically active is very, very important. Even if it's 2.5 hours a week, will keep you healthy for a long, 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 long time. I know it's very hard. We live a very hectic life here in America. I'm guilty. It's very hard for me to do any kind of physical activity on a regular basis. But if you got a weekend, go out there and do it. I don't know about Sierra Leone. I don't know much about what's going on in Sierra Leone because it's been a long time since I left. I don't know how is the healthcare system there, and but even in Sierra Leone, try to be physically active. You'll be surprised. Just that can keep you away. You can keep you from the medication. You can control your blood pressure, and control your blood sugar level. You can control your cholesterol level, and these are all risk factors for heart problems, your heart disease, which is the number one cause of death here in America. So I just want to throw that in. Not
Thank
just
you
the
very
drinking
much,
as well, but
Uncle. No,
all
it's
around.
good that you're throwing that in so that at least people can actually learn and get it. So we have to be physically active, not just going to work all the time. Because I know certain people that I know, especially our friends, they're like, oh, I got to work all the time. I'm active enough. No, that is not the being active. You need to go, and if you can't go to the gym, at least do 5 minutes of walking a day. Just 5 minutes walking a day is physical. Because I remember a doctor told me that once. Because I've got issues. Remember, Uncle, when I used to go to the doctor, I've got issues with my heart. And one thing that he actually advised me, he said, you need to be doing activities. You need physical activity. You need to walk at least 5 minutes a day. So we need to walk. We need to do physical activities at least mentally to help ourselves as well. And try to reduce your stress level. It's very important to reduce your stress
So
level.
important.
But
Yep.
again, I just want to go back to Uncle because I'm reading most of the comment. Let's see the comment that people has actually been saying over here. Please share the video if you can. Invite a friend to invite a friend because this is important. We're talking about our health, something that's actually affecting each and every one of us. I think we need to talk about it. And wow, let's see what Abdul said. Abdul said, "Wow, love you, Uncle. Make us proud." That is Abdul Kanu. That's the Kanu family. My brain box, keep it up,
Hi,
sir.
Abdul.
Yeah, that's Abdul is
Yeah.
watching. Isaac Cabo say, wow, that is good, Uncle. Then Dr. Anthony Keane, Ajebu Dedi, he actually said, thanks for the eye opener. And he said so true as well.
Thank
And
you.
then City actually said, health and wellness is everything. Thank you for this broadcast. Thank you, City. Thanks. He's my good advisor right there. And Ojukutu Macaulay said, I'm so true, doctor. And then Dr. Anthony as well said true. And then Rita said, Rita Jallo. Hi, Rita. How are you doing? Thanks for watching. He said, wise
Oh, I
word,
know
docs.
Rita. Hi, Rita.
And then we actually have Samuel that sent you a clap. And then Richard Jallo actually said, Africans are not known to be physically active. Too many excuses. Absolutely, Rita. It's very important because we, the African people, we don't do too many excuses. We don't do exercise. The moment we go for exercise, the next thing where they say, hey, me, I don't tire yourself. Afterwards, I be working yesterday. We find every single excuse not to do
Right.
exercise. And I think we need to start shy away from that. We need to be doing exercise. We need for actually look after our health. Just the way we take the money for go buy clothes, because we use the money all the time. We go buy clothes, we go buy shoe, we go buy food for the house. That's the same way we need to use the money to look after ourselves. We need to start looking after ourselves because this death of cancer is getting too much in our community. People are dying. The death rate is too much. That is one of the reasons I said, let me get Uncle here. And when Uncle said, okay, we can talk about colon cancer, I was like, praise God. Because this cancer is killing us. And we they die because we know they find out what they do it. By the time we get to the hospital, it's too late. It's too late by the time that we don't enter hospital. That's time that we don't die good on. It's all late. They can't do anything for us. It's stage 4. So this is the time we need to start talking. All of us needs to do campaign. We need to start talking. We need to educate our people. What is causing cancer? Why this cancer they spread? Why they kill we so much in our community? We need to actually start doing a lot of talking about it, basically. Please share the video if you can. It's very important. Tell a friend to tell a friend. It's not a long video. It's a short video. I'm talking to Dr. Kanu right now. Uncle, when it comes to the medical field as well, right, with this cancer, why is it that up till now, they're not able to find medication or something for actually cure them?
Well, the simple fact is they don't know what's causing it, and they don't know how to cure it. They spend a lot of money. The research is ongoing, and our hope is they will find something, down the road. But that's the simple answer. They just no cure for it, and that's why if you have certain cancer that you cannot do anything about, it will happen. It's not. It just happens. Some people are just unfortunate, and if we live long enough, we're gonna get certain kind of cancer, whether it be we black men, whether it be prostate cancer. We'll get those if we live long enough. And that's it. That's a simple answer. But I think a lot of times we kind of we think that medicine cure a lot of things. Medicine don't cure a lot of things. We just manage it. For example, we talk about high blood pressure. Your high blood pressure is a lifelong thing. You just have to manage it. So you end up having a stroke. You don't end up having a heart attack, or you end up damaging your kidney. The same thing with high cholesterol level. It's the same thing. You just have to manage it. You gotta take medication for the rest of your life, like a statin. But it is why I hit on colon cancer, because it's preventable. It's one thing that, not preventable. You will get it, but you can be cured for it if they catch it early. Same thing with cervical cancer for women. It's a preventable death, per se. If you go according to the recommended screening. We talk about colon cancer a little bit. We said the screening starts at 50. Some people get it before that. So, but still, even when it starts from 50 to 75, a lot of lives are saved. A lot. So that's why you have to focus on prevention. Especially in Africa, we don't have enough resources. Let's talk about Sierra Leone. I don't know about other African countries. We don't have enough resources. We have to emphasize on preventive medicine. Because we don't have to wait until somebody gets sick and then we cannot handle it. We cannot cure the person. So we have to emphasize on preventive medicine, and that's where preventive medicine become very, 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 very highly important, especially in third world countries, such as our country, Sierra Leone. Here in America, it's the same thing. You have to try to keep yourself healthy. And these little things we just talked about, you'll be surprised, how much that can keep you healthy and keep you away from the doctor per se. So
Thank you
that's why
very much,
preventive
Uncle.
medicine is so important. Yeah.
Thank you very much, Uncle. And one thing I want to say as well to the viewers watching, if you've got any questions for Uncle, you can actually type it in and then Uncle will be able to answer your questions as well. So any questions at all you've got, just type it in there and then I can ask them before we go and Uncle will be able to answer it as well. And let me bring Uncle back into the screen, basically. Uncle, you actually, we spoke about different things. Yeah, I remember you touched on high blood pressure, which you just touched on it on the surface, basically. But I want to go back to high blood pressure because those are one of the things that's actually because people in the Sierra Leone, especially because I'm talking in the sounds of Sierra Leone, because I didn't make but that's where me and you came from. Now they were born, and that is where we know that people are sick and medication not there for people. Doctor, that's something else. So on Monday, next week Tuesday, I've got Dr. Small who is one of the renowned name for medical doctors in Sierra Leone, basically. Dr. Small is going to be here, so we're going to ask him a couple of questions as well. But when it comes to Sierra Leone, the medical facility in there, it's very, very difficult. And you touch on high blood pressure. Now, one of the things that we're very, very rampant at the Sierra Leone community, and people, they take them like just a joke. Like, oh, me, say my mother suffer from high blood pressure. Oh, say this person they suffer from high blood pressure. But they don't really take it as serious as it really is. Can you touch a little bit on it for us, please? Because I know you just touched base on it. But explain to the people this high blood pressure, how serious it is, and what it can lead to as well, please.
Well, it's a silent killer. That's the thing. You will have it, you don't know that you have it until it's too late. Some people, you have high blood pressure, the blood pressure keep creeping up little by little. You just don't know because your body adjusted to it. If you're feeling bad after a while, you start feeling okay. You don't know the blood pressure is going up. And then get to a point where the pressure in your, the blood vessels in your brain, which can be very small, it gets so high, then that vessel pop open, and then you have a, hemorrhage in your brain, and that's what we call hemorrhagic stroke. And then you end up with the things that we talked about, being paralyzed, not able to talk, not able to eat. And the same thing for the kidneys. That pressure, that high pressure in the kidney can damage the kidney. And if you don't know you have it, and the kidney get damaged, by the time they find out that you have it, the kidney is damaged beyond repairs. You have to go on dialysis and you're going to need kidney transplant. So, and then of course, you can have a heart attack. It's not good for the heart. The heart is pumping against a lot of that high blood pressure, and the heart is just like a muscle, in our body. So if it's pumping too much against too much pressure, it becomes bigger and bigger, and before you know it, you can either have a heart attack or you got a congestive heart failure, which is not, of course, it's not curable. You just have to manage it, and it will shorten your life, your life expectancy. So it's very important. It is extremely important. And once you get on blood pressure medicine, sometimes you have to, most times it's a lifelong thing. You just don't take it for 2 weeks and say, well, I have high blood pressure, I'm cured. And you don't miss your doses. Some medication there, some high blood pressure medicine that you take, if you miss a dose here and there, you can be okay. But certain medication, such as clonidine, you miss the dose here. If you're on it on a regular basis, when the blood pressure is ready for a rebound, the rebound more than where it was before, it can cause damage to your brain and where and your body. So these are very important things that can save you a lot of trouble if you just do the things that your doctor asks you to do. First of all, go and find out what you have, and they tell you to take the medication, take it. Stay away from alcohol. I mean, I see a lot of our people, we drink a lot of alcohol. It's not a big deal. We just we drink 2-3 beers a day, or you go binge drink on the weekend. Well, that alcohol can increase your blood pressure. I will not even touch about diabetes, which is a whole different other subject. So the lifestyle is
I
very,
think
very
when it comes
important.
to diabetes, we'll touch on it in another day when we actually have another
Right.
time when you're free, because it's very, very difficult to catch you on a free time. So whenever you're free, we go get you again and we go come talk about diabetes. Because at the moment, I think for say it's very important the colon cancer we did touch on. And even though we diverse a little bit and touch about high blood pressure, because I think it's one of the killer thing where they kill we Sierra Leoneans them all over the place. But the colon cancer, maybe we come back to him, uncle. One thing where I don't notice now in community, as soon as person sick, right, you don't us. One thing I don't notice now in our community, especially within the Sierra Leonean people, the moment somebody's sick, they're not house, right? Then just they take you, say, oh, Bekuka, you go to church. Before they take you to the hospital, they're taking you to the church. I'm serious, uncle.
Yeah.
They take you to the church for prayers, or they take you to the mountain, or they take you to the juju man. Say now juju or that witchcraft when not with you. Or the moment where something happened to you, you died and say, hey, now which man, I don't witch you. This person also don't come, he don't eat me picking, he don't witch me picking, tell me picking don't die.
Yeah.
Even the doctors, they're medically, scientists go tell them and say, oh, this person's got cancer, or this person's got something of the sort. And then they say, oh, now juju. Which advice will you go give to people them where they behave that way from a doctor point of view, from a medical point of view?
Yeah, I mean, this is, I'll just tell you from a personal point of view, I mean, this belief that we believe in juju, somebody's trying to reach us, we have to change our mentality in Africa. If not, we'll never, ever, ever progress. I got family members that disagree with me. They believe in witchcraft and believe in this, that people out there to get you. And I was lucky to have a dad who never believed in that stuff, because if he did, he would have passed it on to me. I've been through a lot of things in my life. I would have just given up. I said, well, somebody's trying to reach me. Somebody's trying to do this to me. Or when I get sick, I will go to the doctor because, somebody put this thing on me. We have to change that as a people, especially in Africa. We have to change that. As far as going to the Moriman and all that stuff, I mean, I can only tell you about conventional medicine. I mean, there's a reason why the life expectancy in America is extended, because of conventional medicine. People that have appendix, they go do surgery, they take it out, and they do just fine. Talking about colon cancer, the screening for colon cancer, you have it. They take that part of the colon out. Maybe you need chemotherapy. They give you chemotherapy. If you need radiation therapy, you get radiation therapy, and they do fine. I get people living, in their 80s or 90s. They don't believe in juju. They don't believe in, they believe in conventional medicine. That's what I would say, because you get into trouble when you start talking about, well, you don't believe in juju and you're an African. They said, well, you don't become a
I
Western
understand that,
Christian
Uncle. I
or
understand
whatever,
that.
But it's very, very detrimental, extremely detrimental to us as a people. I'm just not touching in medicine alone, in other areas as well. We have to change that. If you're not feeling well, go to your doctor. I mean, I don't know about, Shalom, I've got a friend there, Dr. Williams, very good doctor that I know in Sierra Leone. That's the only doctor that I know in Sierra Leone. Really, really good, and he take care of some of my family members. But here they have really, capable doctors. Just go, let them check you out. Miss Winter, no, I'm sorry, that's my daughter's dog.
Okay.
So go, let them go check you out. I just don't believe in those non-traditional
Medication.
medicine. I just don't. Right, I just don't.
Thank you, Uncle,
Some
for the
people will disagree,
advice.
but yeah,
It's good that we're
yeah.
advising our people and telling them exactly what they're supposed to be doing. Because when it comes to Sierra Leoneans, especially us Africans, we don't believe in medication. We don't believe in seeing the doctors. We don't believe in a lot of things. And the moment somebody's sick, oh my goodness God, always lose. They don't reach me Pekin.
Mm-hmm,
They don't take me Pekin go to
mm-hmm,
Mariman. They don't take me Pekin go to this. They don't take me Pekin go to Dandy.
yeah.
So I'm actually trying to do these programs so that we can educate people out there. Uncle, we're coming towards the end of the program. Because today, you've educated people. I don't want it long because I want other people to come so they can actually watch it without getting bored. Because we need to educate each other. We need to be
Yeah.
educating, people. So, Uncle, before you go, what's now your last word to people when it comes to this colon cancer?
Well, go according to the recommendation. If you're 45 years old, talk to your doctor about getting tested or about getting screened. Here in Kaiser, we don't do colonoscopy. If you don't have a family history of the colon cancer, they have a stool test that they do. They just send you this thing in a package, send it to your home. You do this test, put it in, and you send it back. And that is it's very, very sensitive. You don't have to do it because some people they don't like they don't want to do the colonoscopy. And of course, colonoscopy is a procedure, and it comes with a little bit of a risk. But if you want to avoid that, just do that. Do a annual screening. Do the stool screening every year. If you do have a family history of it, then maybe you may need a colonoscopy, of course. So start for age 45, talk to your doctor about that. If you have anybody that has colon cancer before age 50, tell your doctor, let your doctor knows that. And the annual screening with the stool test, do it every time. And if they start to do a colonoscopy, because some people have what we call polyps, which is just a growth in the colon, the stool test is not going to pick that up. So you're going to need a colonoscopy. If they say you need a colonoscopy, do it. Yeah, I just had a colonoscopy done, about a couple months ago, and it's very, very easy. They put you to sleep. You don't even know they put you to sleep. The prep alone to prepare yourself for the colonoscopy is probably much more problematic than the procedure itself, because you have to drink all this stuff and it kind of cleans you out the day prior. But the procedure is very, very easy. It's the same day. You go there, it take about a couple hours. It can save your life. Um, um, cut down on the red meat. Hey, I'm guilty, of that. But I try to cut down on the things that I eat. Cut down on the alcohol. Stay active. Control the weight. That's very easy for some of us here in America because we live a very hectic lifestyle. We don't have time to exercise. But keep control the weight. Try to get at least a reasonable BMI, which is just a average weight that all of us need to have, depending on our height and on our weight. So, maintain a reasonable BMI, stay away from smoking, be physically active. I mean, just those simple things that you might think that is not a big deal can prolong your life. And if you stay away from it, it can shorten your life, unfortunately.
Well, thank you so much, Uncle, for this discussion. I know it was a short discussion and it's been a while I've been trying to get you. And I'm
No, I'm
blessed.
sorry, yeah, I'm not,
I know,
you
doctor, being a
know,
doctor, you're always busy. But I'm so blessed for you for grace with screen today. And please, for every time you're less busy, this is our station now. So every time you're less busy, please let's just get it on. I don't mind. I'll drop everything I'm doing so that we can educate our people. Because we need to be educating our people. We need to let them know
oh, thank
exactly
you.
what is going on. This way, they can actually learn and they can actually maybe we can change our lifestyle. Because even for me, I'm so guilty with the red meat. Oh my goodness, the red meat is my problem. Suya,
So it's
that thing that they
right,
call suya is my biggest taboo. And I've been telling myself I need to stop eating suya. I need to stop eating suya. And every single time I eat suya, I end up in trouble. So the one thing I want to advise our Sierra people, your health is your wealth. As somebody just said it, Googie. Googie said, health is wealth. And thank you for having this
Yes,
conversation.
that sounds like my niece.
Yeah, Rugi Jane. That's what she said. Yes, and then we've
Yeah,
got
that's
Quinn.
my niece.
She said, "Thank you for enlightening us, Dr. Kanu." That's
Yeah,
Quinetta, and then we actually have Ojukutu Macaulay. We said, "Thank you, Dr. Kanu," and Rita said, "Dieting is very important." Absolutely, Rita, I agree with you with that as well. Then we get Rugi as well. We say, "Meat is definitely is the devil." Absolutely, I agree with that as well. So yes, too many people
yeah,
in
that
Sierra
sounds like my
Leone.
niece Googie.
Yes, too many people in Sierra Leone grasping with high blood pressure. Absolutely, that is from CT Soa. And then Nancy Kanu say, thanks, Dr. Kanu, for this interview. Our people really needed to hear this. Absolutely, I agree with everyone because I just think for say when it comes to health, now we well done it. If you think about it, if you're unhealthy, we can't be having these conversations. If you're unhealthy, think about it. From my COVID come, you got people that we don't die, go to grave day like it today. But God still keep we alive. That is number one. Then number two, if you're unhealthy, think about them people away where they're in a sick bed right now. They can't do nothing. So during the time where God give you this well body, where you still there around the do you want to two or you daily bread, I think we need to take that money where we they use for alcohol. Some of we na alcohol, some of we na we make up them, we they spend that money there, and some of we na close them. Some of we spend that money there for different things them. We need to learn to actually tell we for say, listen, make we spend this money also for we body, for make we get well body. Because well body na gently. Well body na we own. Well body na in the teen where they make me and you they get in kind conversation they also. So please, I'm begging you guys, Sierra Leonean, share the video, press subscribe on my channel. Don't forget, you can follow us on YouTube as well, Calabash Network. Follow us. Just follow us and subscribe and support the network. So at least support you now, Pekin, the Calabash Princess. So that way we'll be able to at least share the knowledge and educate each other. Because that's what I'm here for. I'm here to educate, share knowledge, and actually learn as well. Because I'm learning from all this myself. So thank you all for being here. Thank you for listening. And believe you me, I enjoyed this short discussion also with me, Uncle. Uncle, what's your final word for the Sierra Leonean people and for everyone watching?
Oh, well, let's stay positive, I know, and we try for looking out for each other. We come from a very small country, it's a poor country. We have to look out for each other, help each other out, and stay positive. That's another aspect of health. You stay positive, you tend to stay healthy. Depend on for you personally, I like the informal setup for this show, so they can be informal. We can talk, and you do really well. We thank you for your for giving us this venue, and I know see the rich people all over the from Sierra Leone in Europe
Everywhere, all
and in
over the world.
America. So
Yeah.
thank you. Yeah, thank you very much.
Thank you very much, Uncle. Thank you. I appreciate you very much.
Uh,
And to my Sierra
uh,
Leonean people, and I say my Calabash family, and I also say my Calabash Media Network family, which everyone is telling me, don't do network this as a media house. I believe that too. So in time to come, we're gonna change it to a media house. So for my Calabash people and my Sierra Leonean people, I love you all. And please, please, just be patient with me. I'm not perfect, but I'm just trying so that at least we all can educate ourselves and learn and understand each other. And believe you me, this network is not for politics. It's about educating each other. It's about understanding so that we can learn, you can learn, we all can learn, and we all can benefit something out of it. I love you all. Have a blessed, blessed day, and I'll see you tomorrow evening again. I'll be here tomorrow evening for Women's Corner, Men's Point of View. Thank you, and have a blessed evening.
Thank you.
Hi, Uncle.